Hello, everyone, and welcome back tonight. I hope you've had a really good week and ready to dive into a new topic. Tonight, we're going to talk about labor. When do I know that it's really real? That's a question that a lot of women have. So, what I would like to do is to kind of walk through some things, to walk through what actually is going on with your body in labor. And I want you to think about any girlfriends that you've had, or sisters or aunties. Everyone has a labor story, and some will say, "Well, I was in labor for so many days." So, have you had those kinds of stories? Well, let's talk about what's going on. Labor is the process that your body is going through to be able to open up the cervix, which is the mouth of the uterus or the opening to the uterus, to be able to open it and to thin it out. It also is a process where the contractions are doing that, but also pushing your baby down through the pelvis and out for birth. And I'm going to review this with you and give you some terms that you need to think about and remember. I also have a few teaching aids with me tonight, so we can make this hopefully a little bit more fun. I'm going to, this is going to be the uterus, and this, now your cervix does not look like this, but this is just to give you some idea. So keep in mind that labor, it's possible to feel contractions before it's time to have your baby. And you do not want to ignore that. If you have any contractions that you're feeling before 37 weeks of pregnancy, you want to make sure that you don't sit on that you actually contact your healthcare provider so that you can make sure that there are not any issues. There are some things as preterm labor that can be stopped. Sometimes you can have what's known as a bladder infection that can advance to a kidney infection, and that can cause stimulation because the bladder is right underneath of the uterus in your body. And so it can irritate the uterus. And so you want to make sure that if you're starting to feel contractions before 37 weeks, that you do not delay letting your provider know. Preterm labor can be stopped. So don't play around with that. Don't second guess it. Do not diagnose yourself. Contact your provider. Remember what we said in earlier videos. It doesn't matter if it's 1 o'clock in the morning, 2 o'clock, 3, 4, it does not matter. Do not wait until the morning to contact your provider if you're feeling contractions at night. You're paying them. They are your consultant. You are paying them. Okay. And you also want to rest knowing that everything is fine. If you don't check these things out, you'll be concerned and worried about it. Okay. So that's one thing. Let's just talk about the uterus. The uterus is the womb. It's where the baby is inside, and you have the cervix. The cervix is the opening. This is just something to give a demonstration. All right. The cervix is closed, and there is a mucus plug. We saw that when we looked at some things earlier videos. There is a mucus plug that plugs. The bag of waters is inside of all of this. Okay. And so when labor begins, what labor is going to do is to open up that cervix and to thin it out. And I'm going to show you something else so you can see how much work your body is doing. It's also going to push your baby down and through the pelvis. So there's some terms to know. In terms of the cervix, the terms to know is how effaced, meaning how thinned out. It gets to be 100% thinned out. And how dilated. The dilatation is going to go up to 10. Let me show you a different aid. Hold on. So you're going to start out with a cervix that's pretty thick, okay, and long. So when you talk to your providers, you want to ask this information. I'm trying to get this to see where it works for you all. All right. All right. So if we were to start here, this is where the cervix is. We're going to go from 1 centimeter all the way up to 10. And you're opening up pretty much, I'm up until this is approximately 4 inches across. So all of this work is going on in your body when you go into labor. You're going to open that cervix up all the way from closed, long and closed is the terms you might hear. Long meaning that it has not effaced at all. Effacement is how thin is it? And closed is how many centimeters is it opened up? Okay, 10 centimeters is about a little over 3 inches wide. So you're going to go from long and closed all the way to about 10 centimeters open up, to 10 centimeters. It is also paper thin. So when we say it's 100% effaced, it is totally thinned out. Okay, that's what's going on. The other terms that I want to bring up to you is for you to know the station. This is your pelvis. We all see this. And if you can see, these are called this little area here, these are called the ischial spines. I have a larger pelvis. We can see better with that. Wow. Okay. This is the ischial spine here. Okay. And so when we talk about what is the progress that you are making, we're talking about how is the baby moving down through this pelvis and where is the location of the baby's head to what's called the ischial spines. Now, if the head is above, it's going to be -2, -3, -1, and then when it's even, it will be 0. Then as the baby advances down, it will be +1, +2. That is the station. So whenever you are examined, you need to ask this information. What did you find? What was the, how far open was I? How far dilated? How far thinned out, meaning how was the effacement? Effacement is the thinning. Dilation is the opening up, okay? And then what is the station? Where's the baby's head in relationship to the spines on the pelvis, all right? And so this is a whole labor process. This is everything that's going on when you go into labor. Now, there are different stages of labor. Early labor is going to be where you are long and closed until you are about 3 to 4 centimeters would be early labor. And that takes time. That takes quite a lot of time. And it's normal that it can be about 20 hours and it's still normal. This is why I want to impress upon families that it's really important that the mom is getting rest. We don't know what time labor is going to happen. If you've worked all day and then you come home, you fix dinner, now you're tired, you don't know. Labor could happen in the middle of the night. We cannot control when labor starts. And so I always encourage mothers and fathers to rest up prior to their due date, about a couple of weeks out, because you can go into labor 2 weeks before, 2 weeks after your due date, and it's still considered normal. So my recommendations are that you start beginning to rest up, to be taking it easy. Even if you go to bed earlier, even if you're not sleeping, just rest more. Rest through the day, go to bed earlier, because you don't know when labor is going to start. So up until from long and closed, what we've talked about here, long and closed, where we are. Long and closed here, up until about here is considered early, about 4 is considered early labor, all through here. Okay. You're not really into active labor until you're about 4 to 5 centimeters. All right. Now, how am I going to know what's going on with my body? And this is what is going to cause a lot of women to try to figure out, when am I going to be in labor? Well, you can have contractions that can be what's known as false labor. What is false labor is when you start to have tightening, but it's all in the front. And the contractions may have some pattern to them, or they may not. They don't increase in intensity. They may have a pattern, but they may not. And then they will kind of just go away. However, that false labor can sometimes keep women up and keep them thinking, oh, I'm going to start into real labor. And I want to just say to just relax, to not get all anxious about it, to try to live life normal, go about normal routine. And when contractions are beginning to be real, they will start to feel more in the lower part of the back and come around towards the front. They may feel more like menstrual cramping. For women who experience menstrual cramps, they will start to feel more like that, where you will feel them lower. And then as the contractions, they will start to have a pattern. And I'm just throwing out numbers. This is not going to say how your labor will be. Everybody's labor is different. Say if you started having contractions that might start out with false labor, they might be, 5 minutes, 15 minutes, 7 minutes, 10 minutes, no regularity to them. And they will not last very long. Okay? Whereas when real labor starts, they will begin to have a pattern where they are, I'm just throwing out numbers. They're not usually going to start out at 5 minutes. I will promise you that. And that's not the norm. But say it's like 15 minutes, but it's going to be every 15 minutes. And then it will start to get closer together, where it might be every 10 minutes. And it might be then work down to every 7 minutes, every 5 minutes, but it's every 5 minutes. They will also begin to last a little bit longer. If contractions are lasting for 30 seconds, they're helping to get your body ready, to get you warmed up for the real event, but they will increase in how long they last. Okay? That is what real labor will be doing. A lot of times providers will say, give me a call when your contractions are 5 minutes apart for an hour. So that will be what might be the instructions that your provider gives to you. So you need to check with the provider as to when they would like to be notified. They can help manage a lot by phone with your contractions and with your labor. Now, breaking the bag of waters is also a part of labor. And that is something that there is absolutely no control around. Again, this is just your baby, okay? We've got feet hanging out. The bag of waters is the sac that the baby is in. It is a sterile sac of fluid. And so anytime the bag of waters is broken, then it keeps the baby sterile, okay? But once there is any break in this bag, then it now allows bacteria to be able to enter. How large is bacteria? Can you see bacteria? You can't even see bacteria. So it doesn't need to be a huge break. It could be a small break in the bag. When you break your bag of waters, I want to say very clearly, it is not necessarily going to be this huge, big gush of water. A lot of women might be looking for that. That is not necessarily how it's going to happen. It may be a slow, continuous trickling that you cannot control. We can hold our urine, but you cannot hold the bag of waters, okay? The urine is coming from your urethra that goes up into your bladder. The bag of waters will be leaking from the vagina. So I want to also say this is another time where you need to be in touch with your provider. If you notice any possible leaking, do not sit on that. You need to contact your provider and be seen. They can determine whether or not you have broken your bag of waters. And how is that done? It's done with a pelvic examination where if there is any leaking, you can do a culture and you can just put in a swab and see and look at it under a microscope to be able to determine did the bag of waters break or not. What's so important about this? Once the bag of waters breaks, that your baby is now exposed to bacteria. The vagina is not sterile. It's clean, but it's not sterile. Okay? And so anytime anyone does a vaginal examination on you to check to see how far open the cervix is, they introduce bacteria up towards that cervix. Okay? And so over hours, you run the risk of infection getting into of infection setting into the bag of waters, which can cause problems very much for the baby. So you do not want to play around with the possibility of any leaking of fluid. Once again, you can hold your urine. You cannot hold when the bag of waters is leaking. Again, it can be a slow, continuous trickling. So if you're putting a pad, if you have to put on a pad when you never had to wear a pad before, that's an indication you need to be checked out. Okay? We don't normally wear a pad in our underwear, when we're pregnant. It's not necessary unless you're just doing it for your own hygiene purposes. But it's not normally necessary to wear a pad in your underwear. But if you find that you need to put a pad in your underwear for any leaking of fluid, then that's an indication that you need to be seen and evaluated. Also, notice the time when that began to happen. The risk of infection increases greatly after 18 hours of the bag being broken. And this is then when there's the desire or thought that, we have to be very careful. Then you may need to have antibiotics, need a cesarean section, all of that. So it's nothing to play with. So there are two things to not play with in terms of labor. If you start having contractions that you're feeling before 37 weeks, do not play, do not sit on that. Contact your provider. It's possible to have preterm labor. Preterm labor. Preterm labor can be stopped if you address it early enough. You don't want to have your baby be born too early, if at all possible. And you can try to stop that by getting to your provider earlier versus later. And I would say if you need to just show up in the emergency room, then that's what you need to do. If your provider's not responsive and you do not feel comfortable, you are the one who needs to be comfortable, not the provider. You are the one who needs to sleep at night knowing that your baby is okay, not the provider. You are paying them, they're not paying you. Okay? So make sure that you have ease of mind. The other is if you start to leak fluid that you cannot control, do not sit on that. The other things that I want to say while we're talking about this, if you are concerned about your baby not moving as much, you should be very concerned about getting attention to that immediately. Why do I say that? I don't want to be scary, but I'm being realistic and truthful. Babies can die in pregnancy. You can carry a baby all the way through pregnancy, and babies can still die. And when I have had moms where their babies, this is called stillbirth, okay, where a baby has died during pregnancy. And when you talk to mothers, this is their concern. They felt the baby wasn't moving as much, but they didn't want to bother the provider. I say bother the provider. One more time, you are paying for their service. It's your baby. Okay. It's much better to go in. What would they do? They would put you on the monitor, make sure your baby is doing okay. If the baby is not doing okay, then other measures can be taken. So these are the things when you need to contact the provider. If your baby is not moving as much, and mothers know how their babies move, they know, and they know when the baby is not moving as much. Dads, you can just check in. How's the baby doing today? Okay. If you're leaking fluid from your vagina, that it's a small leak, when you break your bag of waters, it is not necessarily going to be a huge gush. It can be a slow, continuous leaking that you cannot control. If you're having contractions before 37 weeks, go in. The other thing, and we've talked about bleeding previously in other episodes, you should not have any blood in pregnancy that requires you to put on a pad. If you do, bright red blood, it's not good. It's a danger sign, and you need to be seen immediately. So thanks again for coming tonight. I hope that this has been good information for you. Oh, let me finish. I gave you all of that. Okay. We got to get this baby born. You're going to go all the way to 10. The baby is going to move through. Okay. The baby is going to move. Your labor is pushing the baby down, turning the baby. Okay. The baby is actually going to be turning inside of the pelvis so that the baby can be born. Most babies are born looking down at the floor. Okay. Some babies can be born looking up, but most babies are born looking down, and that's okay. If they're born looking up, that's okay. You will probably need to push longer because of how the baby has to move through the pelvis. Once the baby is born, the placenta also needs to be born. And that happens after the baby is out. The placenta is born after that. There should not be a rush to deliver the placenta. And this is where we can run into trouble with hemorrhage. Why is that? Because if the provider is rushing the placenta to be delivered, the placenta will detach itself from the wall. Okay. Let's see. Let's get this baby born or out. All right. The baby is out, but the placenta will actually, you will have more contractions. The placenta will actually detach itself without anybody's help. If you're patient, without any help, you will have more contractions after the baby is born and out that will then cause the placenta to detach from the wall of the uterus. It will then be born. The cord is still pulsating once the baby is born. And some families say, please do not cut the cord until the cord stops pulsating. The baby is getting a transfusion of blood when that cord is still pulsating. It's no rush to deliver this placenta. No rush. And then the baby gets that blood transfusion, and then the placenta, if you leave things alone and stop tugging on the placenta, try to get it delivered early, it will deliver on its own without trouble. So we talked about maternal death, hemorrhage. This is one thing, trying to force the placenta to be born before it's ready. Okay, mothers die can die from hemorrhage from this. Also, if there are tears that are done. So after the baby is born and the placenta is born, the vagina will be inspected to make sure there are no tears on the wall of the vagina, the tissues, and also around the cervix. So I've talked a lot tonight, but this is what happens during the labor process. After you've had your baby, after the placenta is born, you should be watched very closely for at least an hour. And the uterus should be checked to make sure that it is contracting well, that the bladder can be emptied. Because the baby is sitting right on top of the bladder, in earlier videos, you can see some of this. Because the uterus and the bladder are right next to each other, during labor, the bladder can be desensitized because of the baby's head up against the bladder. And that desensitization causes the mom to have no sense or urgency to use the bathroom. And when the bladder is full, the uterus cannot contract like it should after the baby is born. So we want to make sure the bladder gets emptied, that the uterus is able to contract like it's supposed to after this baby is born. So the mother should be checked every 15 minutes for at least an hour after the baby is born to make sure that her blood pressure is fine, that she's not bleeding too much, okay, and that she's able to urinate. So these are the things that happen during labor. I hope that this has been informative for you. I jumped all over the place a little bit, but I think I gave you the information that you need. I really wanted to impress about the key critical things to make sure that you're in touch with providers about. So thanks for listening. Subscribe to my page. For those of you that might be watching who haven't subscribed yet, please subscribe. That will let you know when I'm going to be doing more content. So have a great night, and tell your mom, your dad, your sisters, your brothers, your aunts, your uncles, your nieces and nephews. Tell them to come and check out my channel and to subscribe. Thanks so much. Bye-bye.